This is Mel Majoros. I'm the cancer warrior, and this is how depression factored into my breast cancer journey. I didn't expect it to happen. People think, well, it's cancer and you'll get through it. But seeing yourself go from someone who's like physically strong to just kind of not necessarily, I didn't like wilt away or anything, but you just kind of look different and you feel different. And it doesn't matter like if you live in a small town or a big city, you kind of feel a sense of isolation. And like I said before, you feel like, well, I don't want to talk to my fiance about it because he'll just say, it'll be all right, honey. And, what else is he going to say? Like, no, it's not going to be all right, which he would never say. Or calling your friends. It's like, what? She's going to talk about cancer again. And there's just the last thing I want to talk about is her hair falling out or not being able to eat. So you kind of feel in your own mind that there's nobody to talk to. So that tends to get you really depressed. And, people always say, well, call me whenever. Well, you never get depressed during 9 to 5. I can tell you that much right now. So it's a hard thing to deal with, knowing that you are a strong person and that it's not something that you can control. Like not being able to eat, you can control that. Not having any hair, it'll grow back. Being depressed, it's a mental issue that is basically synapses in your brain. Once you realize that it's something like it is a disease such as cancer, and I talked to my doctor and I was just like, I'm just feeling kind of lost and hopeless and I don't know what to do. She prescribed medication for me, which, also is a bonus because it helps with the tamoxifen side effects. So having that, knowing that I could actually talk to somebody about it and also talk to other survivors, realizing that I wasn't the only one going through this, was also a godsend, because you just feel like, well, I don't want to tell other people that I'm feeling depressed because, I know this sounds kind of, what's the word I'm looking for? Conceited. It's like, well, I give all these other people advice. It's like, they don't want to hear that I'm all sad and depressed and, that's not cool. What are they going to think of me? It's like, well, you're just like everybody else as far as being depressed and getting through this. Some people don't get depressed. I did, and it was hard to realize that, you take medication, it's a problem in your brain. It's nothing that you can change. Just be like, oh, just be happy and it'll be fine. It doesn't work that way. You can take medication, which I do. You can talk to a psychiatrist or a therapist, talk to your doctor, find somebody who will help you, and you can go from there.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.